All right, so we've got a patient here with a really painful little lesion that looks like a corn. It's in a slightly odd spot because it's not the most weight-bearing area, but if we know the anatomy of the foot, there is a little bone in there that can stick out and cause pressure in this area. It's really unfortunate because this one, they're really painful because it's not particularly a hard piece of skin that we're or a thick section of skin there. So basically we've removed the callus cap there. Now you can see that central corn. So we've got to go in there and remove all that out. So we're going to just as easily and as sort of gently as we can go and cut right around the edges. Now this one's a little bit difficult because we're cutting the boundaries of the living and the dead skin are a little bit hard to see, and they're not very well defined, and it's just a little bit difficult to actually see this. So we've already got a little bit of blood there. So it's all right to get a little bit of blood. Obviously, we try not to, but sometimes it's unavoidable if you want to get the whole corn out in one go. So we're just going ahead and trim that around. You can see there's probably going to be a bit more blood come out of here. And we're just always keeping an eye on the patient just to make sure it's not too painful to take this one out. So we'll get that out. I'll see if I can get it out without dropping it on the ground. But you can see the hole already sitting there. So you can see on the end of the scalpel there, that's that little tiny corn. So it's about half a grain of rice. Really, really painful to walk on because it's actually fixed under the skin and you stand on it in the same location every time. So we're just going to clean the rest of that out. And then what we'll do with this one is just sand it all down, smooth it up, dress it up, because you've got that little bit of blood there. That's what looks a little bit darker in the central section. We'll zoom in and have a look at that and just see, you'll see a little bit of blood in the bottom there. And we'll review this one probably in about 4 weeks to make sure it all heals up well.